Good afternoon and welcome to the 28th episode of Genomics Gupshup. Genomics Gupshup is where we get experts who can come and simplify the field of genomics for us. We also get to understand their journeys and be able to understand what they can give as advice to others as well. Today, we are delighted. We have a very special guest, Dr. Aparna Sreevatsa, and she is a medical oncologist in Karnataka. Welcome to the show, Dr. Aparna.
Yeah, thank you. I'm happy to be here.
Thank you so much, Dr. Aparna. And before we get started on, talking about genomics, we want to understand a little bit on why you chose to become a doctor. Who inspired you to become a doctor?
So as a student, as a child, I didn't have my own ambitions as to what I should become. So my father was guiding me to choose the careers. And he said that you are a very hardworking and studious child. You should take up medicine, which is very hard and it is a very tough course. So he said that maybe medicine is good for you. So I took up medicine and I liked the whole entire course was very tough, but I really enjoyed pursuing that course, and that's how I became a doctor.
And you also chose the most difficult of the professions within the medical field. I think you've chosen oncology and that too, medical oncology.
Yes.
One is why did you choose that? And second is, can you help us understand what the different types of oncologists are? Right? You have your medical, surgical, and radiation. So what does each one do? And why did you like medical oncology over, let's say, surgical, for instance?
Yes. So during my course, MBBS starts with anatomy, where you must have heard that we have to do dissection of the cadaver and learn about different organs. So I used to find it very difficult to cut the body and dissect it. I was not the cutting person. I am a thinking person. So I decided in first year itself that surgery is not for me. I can't cut the body parts. It is my character that I am more comfortable thinking, reading, and more of the thought process than the cutting part. So I chose medical oncology because I wanted to cure this very tough disease. Cancer is a very difficult disease to treat. So I thought that let me handle the cancer with medications. So medical oncology is a field which uses medications in the form of injections or tablets to cure or control cancer. So that is medical oncology. And the second one and the most oldest form of treatment for cancer was surgical oncology, where you do surgery, you cut open and take out the tumor from the body. That is called surgical oncology. And the third one is radiation oncology, where we give invisible rays. This modified form of X-rays are given to burn the tumor inside the body. That is called radiation oncology. And I'm not a very egoistic person or anything. I'm a very scientific person. So for any given patient, all these three modalities, be it medications or surgery or radiation, all of them are very important. And we usually practice as a team, that we have a team and we decide what particular treatment a patient has to take, and that's what makes the field of oncology very exciting and fulfilling.
That's amazing. And you're also a gold medalist, is what I read in your
yes.
So now that cancer is known as a disease of the genome, right? So when did you start using? I mean, was that something that was introduced in your MBBS or an MD curriculum, or was that something that was introduced to you and you're given that you are interested in learning more? Is that why you chose to look at genomics as something that can help your patients, or when did you get started on that?
Yes. So just like how our whole body is controlled by our heart and our brain, a cell at the cellular level. So every single cell is controlled by its own nucleus, or the DNA, or the genetic material that we inherit from our ancestors. And so the genetic material or the genes are the heart of our cells, and any disease, and especially cancer, is a disease of the genome, and the problems in our genes lead to this cancer. And it was actually introduced right from MBBS level, that we learned how the cell functions with the help of our genes, and how the pathology, like when something wrong happens to our genes get damaged, causing mutations, it causes multiple problems. So, but I didn't realize that till I came to oncology, I didn't know that we were doing the genetic test so rampantly, and for almost every other patient, we are ordering it in the clinic as well. So we used to think that it is very bookish, that we are reading it only in the books. But over the years, say last 20 years, so much of revolution has happened in the field of oncology, as well as in the field of healthcare, that we are actually doing all the most of the tests that we read in the books.
Right. And I think today, I think there's not much difference between the kind of tests that you can do in India or abroad anywhere. And the access is pretty much there everywhere.
Absolutely, yes.
One of the other things that we are seeing is that, suddenly the number of cancer cases are showing to be up. Is that something that you are also seeing? And what are the kinds of cancer that cases that you normally see in the clinic, for instance?
Yes, actually, the number of cases are increasing so fast that as oncologist, I see every day, I see patients with cancer. Even I am surprised at the numbers that I am seeing. And the age at diagnosis is also decreasing. So earlier we used to say that cancer is a disease of elderly people. But I'm surprised that people who are 30 years, 35 years are getting diagnosed with cancer. And the stage at which we diagnose cancer in India is very advanced compared to what we see in Western literature, because we are not aware of the symptoms of cancer. Patients are not aware. They don't come up. They don't consult the doctor at the appropriate time, and we are seeing patients with advanced stages of cancer. And the usual common cancers that I see is breast cancer, cervical cancer, ovarian cancer. In women, these are the most common. And in men, we are seeing a lot of these head and neck cancers, this oral cavity, throat, and lung cancer, colon cancer. And these tobacco related cancers are very important in India, and I think they're not getting enough attention or the media alert. And I think our government also has to take strict actions to curb tobacco use. And not only tobacco, so many patients, they ask me, we don't drink, we don't smoke, but still we are diagnosed with cancer. They're totally shocked. So increasing age and changing lifestyle, we are becoming very sedentary. We are not doing exercise, and we are eating a lot of junk food. And I think there is excessive consumption of fatty foods, alcohol. So because of the changing lifestyle also, cancers are increasing. And in the next 10 years, so if you take the global scenario, the top number one is China, and the second is US, and third is India in the current scenario. But it is expected that with increasing population, India may supersede all these two, and may come to top number one position also.
Yeah, and I think that's scary, because you're saying that a lot of, and I think even the other doctors are telling that most of the cases we see are still stage 3, stage 4 cancers. And I think you mentioned a very important thing that, initially people used to think the only bad things that might cause cancer would be smoking or drinking, but junk food and a lot of the lifestyle habits that we have are probably something that people are not aware that that can also be related to cancer. Things that's maybe something that you think about from a diabetes or other perspective, but I think a lot of things in the body are probably connected.
Correct.
I've really appreciated. I think you also do a lot of Instagram videos and awareness videos that you've been doing, and I think that's something that I think more doctors also need to do to keep that awareness level high. Because in the US, I think we found that as the awareness levels and also the access to genetic testing increased, people were doing the tests earlier and they were able to diagnose it early. So I think that's something maybe if we create more communication campaigns from across the not just all of us but also maybe like you mentioned the government, I think it'll be fantastic. I clearly, I mean, I'm a big proponent for early genomic testing, but in your case, where do you see genetic testing or genomic testing helping your patients? I know you said every other patient pretty much looks at it, but do you look at it more? But since they come in at stage 3, stage 4, is it primarily used for treatment or is it primarily used for a diagnosis as well?
So I'll tell you my journey of this genetic testing over the last 10 years that I've been practicing oncology. So initially when we were in training, we used to say that yeah, genetic testing is required for this patient, but maybe she may not be able to afford it. So those days, genetic testing would cost as much as the treatment, the whole entire treatment package. If you take the genetic testing would cost almost a big sum of money, and many of the patients wouldn't be able to afford it. So we used to go ahead with treatment, and in the end we used to say that okay, your treatment is over, now you may get the genetic testing for your future generation, like for your children, grandchildren, you may go for genetic testing. But over the 10 years there is a tectonic shift in the way that we are seeing genetic tests. Today it is no longer a test only for genetic counseling for the children for taking preventive actions. It actually starts with the diagnosis itself. So right at the time we diagnose, we want to know what is the genetic problem that the patient is having. It may not be inheritable. It may not be inherited. So it may be something wrong with the genes, and I want to know whether I can make a tailor-made treatment option for this particular patient. So I don't want to stick with the age-old treatment options like chemotherapy. I want to offer something better for my patient, which is almost like a tailor-made option for that particular patient. So today the genetic testing is starting right at the time of diagnosis, and it is giving myriads of options for the patients. And you might have known that chemotherapy is a very harsh sort of a treatment for the patient with a lot of side effects. Patients are very scared to take chemotherapy, and the patients' children, they don't want to give chemotherapy to the elderly patients. So they are always asking us, is there any other option? So we say that yes, we have multiple options for you based on your genetic aberrations, and we actually give targeted treatment for that particular mutation which is driving the cancer in that particular patient. So it starts with the diagnosis itself. It guides the treatment options, and some of the patients who would have taken the traditional conventional treatments and they fail after multiple episodes of treatment, and they are desperate looking for new options. So it guides a relapsed sort of patient who has taken multiple options. It gives a new direction to that patient, and many of the patients, they do very well with that kind of tailor-made options. And of course, the age-old preventive indication is always there. We always suggest these genetic testing to alert the future generation to be careful, to embrace the screening tests at age-appropriate durations, so that they should detect it in an early stage where the cancer is still curable.
Absolutely, thank you. So one of the things that you mentioned was that, at one point the cost was quite substantial. And the other thing that you mentioned, which was also that, sometimes you try out other things and then genetic testing is used as something that you use in the end. And I remember that, the reason why we created the DNA OncoNext was primarily that a lot of doctors said the same thing, right? You want something that you can use as a first line rather than something that you use later. And I think that's why we created a smaller panel that allows you to do much greater depth in that. But how do we make this process simpler for clinicians, right? I mean, see, you are a relatively younger oncologist. Maybe you said that it was part of your curriculum. But if there are people who were graduated earlier, is there something that we as the industry can do something to make the process easier for clinicians like yourself? From understanding it from a genetic test point of view, do you think there are things that we should be doing and we haven't been doing?
Yes, as you said that this genetics, the field of genetics itself is ever changing. And though it was in my curriculum, even today I want to learn new things, that there may be a lot of changes happen, and the thought process also changes sometimes. So this continued medical education is extremely important. And how you might help the doctors is that you may come up with your own database. Suppose you have done so many testing for various indications, maybe preventive or diagnostic. So you come up with the newsletters, or you can do a webinar and tell us what you actually understood. So it is not just treating the patients or doing their testing. We should actually learn from our own patients. So I usually do it every 2 years, that I sit and look at my own data. See, last 2 years, these are the patients I've treated. They came in these stages. I gave this treatment, and this is the outcome. What is the final result that I have been delivering to the patient? And is it appropriate? Is it on par with the international standards? So we look at our own data. We should learn and read our own patients, and that is when we become more and more confident about this whole process that we have been doing. And it is not only that you should learn, you should actually propagate that knowledge to others also. So if you tell, because I may be seeing, sending the tests for 5 of my patients, but you are doing it for maybe 500 patients. So you have a bigger experience and exposure of this field. So you should stand up as a leader, and you should tell us that, see, these are the things that we did. So these are the new mutations that we found. And what is happening is, we always read Western books, be it our curriculum or later we read journals, we read research articles which are done in Harvard or Stanford. And we assume that the same thing holds good for our Indian patient, but it is not so. So our genetic pool itself is different. And so I think that is where you come in, because you are in our own zone of the, and India itself is such a big and diverse country. And so you can actually tell us that we got samples from these places. You can make a map, and you should tell us that this is what you found, and that will be of great help to all the clinicians.
I think that's an absolutely fantastic suggestion. And the other thing, of course, we do webinars, but I think we have not been maybe not talking about it too much, like we have not been able to propagate that very well. So maybe we need to do better at that. I think the other thing about newsletters also, I think we need to make it more regular and analyze. But and you think that the reporting itself, like in terms of, like when you mention new mutations, sometimes I think one of the things that a lot of doctors see are things that they feel that they can't understand that well on a report like VUS or something like that. Do you think that making it simpler would help as well?
Yes, it's correct. Yeah. So I get such a usually we are used to some set of mutations, and some new mutation comes in. That's like a bouncer for me. So I tell them that please send all the data, and to read and to understand, it takes me a week or so. But I tell my students or like my assistants also, see, this patient has come as a teacher to educate me. So I always take this opportunity to learn something new.
Great, thank you. So let me move on to I know that I've seen some of your Instagram videos, but let me ask you one question. In your opinion, what is prevention, and how can people prevent disease?
So prevention is a very important part of the disease process. It may not be cancer. You take any other condition like heart problems or diabetes or obesity. So prevention is very important. So some of the problem with cancer is that cancer is not a single disease. It happens in different places. Breast cancer is different. Lung cancer is different. But we have some general principles, the broad principles. Sometimes cancer may not be prevented, but some things are in our own hand, and we should take a step to prevent some of the conditions. I think the most important thing is tobacco and alcohol. So even in my videos also, I always tell them that alcohol and tobacco are bad. That's why people don't follow me, because it is they understand that it is bad, but they don't want to let go of it. So I think that is very important, that the indulgences, we have to be very careful. And the second most important thing is eating a lot. So we tend to eat a lot, and in India we associate food with the celebration, and anything happens, we eat a lot, and on a daily basis also we are eating too much, and we are not able to find time for workout and shedding those calories. I think that's very important, that as we cross 30 years, we should start cutting down on the portion size, and start eating lesser and lesser. And you might be seeing older elderly patients who are like 80, 90, they don't eat, they just drink milk, and that is their dinner. So I think we should learn from them. If you want to have a long and healthy life, I think we should start eating less, and or if you are an exerciser, if you can work out and shed the calories, then you are welcome to eat as much as you want.
Yeah, we have a grandmom at home, and she, practices exactly that, right? So she's over 100, and she still, like, from the time I know her, she eats only, like, she skips one meal always. And now she's even made it lesser, right? So at night she pretty much doesn't eat. Her portions are really, really small, and she still walks around, right? I mean, and I think, the curiosity to walk around to find out what is going on, I think both keeps her mentally and physically active as well. So I saw that one of your videos said walking is a man's best friend or something.
Absolutely correct.
So in your view, what are those common myths that aren't true, right? I mean, I'm sure that, many patients must be coming to you with some myths that they believe in. So where do you see, especially for cancer, where do you see that in your
Yes, a lot of misconceptions are there. First thing is that it is not curable. So it is a death sentence. They think that once you are diagnosed with cancer, you are definitely going to die. So that is not today's world. We have come a long way, and we have understood the disease, and we are giving cure for cancer. And the second thing is that it happens only to those who smoke and who drink alcohol. That is also not true. That it can happen to a teetotaler who hasn't smoked or anything. And the third one is they think that it is contagious. If you sit with them, eat from their plate, you may also get cancer. That is not true. It is a disease of the genes of that particular patient, and it is not contagious. And the fourth thing is that there are no all the treatment options are very toxic and they will kill the patient. That is absolutely not true. That the treatment options are becoming so sophisticated that you can take a cancer treatment with very minimal side effects and you can get a cure and live happily ever after.
Thank you. Actually, this part about contagious, cancer being contagious was something that I discovered that people thought about was quite recent, because I knew that cancer wasn't contagious, but clearly a lot of doctors get to talk to a lot of patients and families who think that that is true. So, that's something that I've discovered also talking to a lot of, doctors over the last year or so. Another question I had for you was, in your view, what is digital health and is it important?
Yeah, digital health in today's world is absolutely important. And as you said, that not many doctors are on the digital platforms. And I see many of these creators and these youngsters, they actually propagate misinformation. They are giving wrong informations because they have a lot of time. So our doctors, they don't have time to make videos, or they'll not be knowing the importance of digital health sometimes, and mostly they'll not have time, and they will not come forward and talk about cancer, say. But other people are telling that cancer is contagious, you should not eat potato when you're taking treatment. All sorts of misinformation they are spreading. So I thought that to combat that misinformation, you should give the right information and on the right platforms. And today what's happening is that people are moving away from television. And we used to call television the stupid box, idiot box, but they are having these portable small idiot boxes in their hands. So they're all hooked to the phones, and they don't know what to see. They're just scrolling through. They're just scrolling, and they'll see whatever comes. So if you are giving the right information and the patient hits the proper button, you may actually be giving the right information to the right patient. So I think it's very important that you should be online, you should give information on digital platforms. It is not for publicity or anything. It is just to spread the right information to the right people. So I think our patients or our people are not bad. They are not bad people, but they are just not aware of symptoms of cancer or about the preventive aspects. That if you give the information, they'll actually imbibe it. I think they will definitely appreciate, and they may. So if I make 10 videos, not 10 things they may understand or grasp, but I'm sure one video will definitely make some impact, some small impact it may actually make. So I think digital health is an absolute necessity of today.
So I think talking about that, there was one video that really caught my attention, primarily because I love teas and I keep experimenting with teas. So what was the connection between tea and cancer?
Yes, so if you read about cancer and these beverages, usually they say that green tea is very good. It has antioxidants, anti-cancer property. You should drink green tea. But it is not in our curriculum. We never had green tea as children or now. We don't drink green tea, isn't it? So something new, if you want to start, it is very tough. So this recent study from UK, it said that even the black tea or the normal tea that we drink has a lot of antioxidants, and on a regular basis, if you drink 2 drinks per day, even if you, sometimes they say that if you add sugar, it will become fattening. If you add milk, it will add to your weight, and you will not get any benefit of the beverage. But this was a nice study which said that it was actually good to have tea, and it reduces the risk of death from not only cancer but also heart problems and stroke. So I thought that it is very nice, and I was myself excited about that study, and I had made a video.
So any questions that you may have or any piece of advice that you can give our viewers before we move on to the rapid fire, which is our closing round?
Yeah, so my message to all my patients and also the general public is that you don't get scared when you hear a word. Some things like cancer or chemotherapy. Sometimes just hearing that word, you get disheartened and you get disappointed. Don't get scared. Any question you have about cancer, you please go forward and discuss with your oncologist and get your answers. And it is very important that you learn from the experts and not from any whenever you get an information on the WhatsApp or any media, you check the authenticity of that person, whether he has the right degree, or I mean, is he learned enough to give that kind of information. Always check the authenticity of your source.
Great, thank you. And so you are originally from Karnataka itself? Or?
Yes.
Yeah. Okay. So can we move to the rapid fire?
Yes.
All right. So if there were 3 words that described you, what would those be?
It is eager to learn always.
Okay, great. Your favorite book or movie?
Yeah, my favorite book is The Emperor of All Maladies by Dr. Siddharth Mukherjee. It is about cancer.
I have to tell you, that is the most recommended book so far.
Yes.
By many of the guests, and especially I think people who are from oncology. I love that book as well. So I think it's great. So if you would not have been a doctor, what would you have been?
I wanted to be a journalist, just like my father.
Okay, excellent. And is there any favorite place that you enjoy visiting?
Yeah, Goa.
Goa, nice. All right, great. So I think that's what I have right now for the rapid fire. And if there's anything else you'd like to say, otherwise we'll close this round of Gupshup and hopefully get to meet you in person at some other point.
Yes, I think it was a great discussion, and Mapmygenome is doing a great job spreading information and also doing a lot of genetic testing for the patients as well as the family. They are also doing this counseling, genetic counseling for the patients. So you're doing a great job. Keep up the good work. And as you said, we shall meet sometime soon.
Thank you so much, Dr. Aparna. It was such a pleasure talking to you.
Same here. It was a great opportunity.